No, just have the cords correct.
Right.
Yep, so you can do this. Make sure you have enough length.
Do you recommend like pulling this way so
Yep,
you have
and
it?
leave it here. And try to see if you have any, yep.
Knots or
Yeah,
anything?
knots before you pass it off. Once you pass it off, you gotta figure from the other end.
Want this end, right?
You wanna pass this end off?
Yep.
Yep. And remember with cords, you gotta remember your little square here, okay? You don't wanna go too high.
So as a circulator, I can't touch up
You
here.
can touch from here,
Okay,
like
so I can
anything
just
below.
reach down, yeah.
Exactly, yep. And sometimes, a lot of times circular is busy doing something else, like charting, or getting drugs. We'll just toss the cords on the floor and you will
And then this
plug it in.
goes
This
to,
goes actually into the monopolar, yeah, just like that, that's fine. Yep. Yep.
And we were talking to you earlier, you said run this one as well.
You can or you don't have to. Sometimes I don't use it, sometimes I might use it with another type of suction device, but you can just leave it first, we don't need this,
Okay.
yeah. And I don't need the Bogey for now, unless I
So
need
just
it
set it
later.
off to the
Sure,
side.
yeah, just make sure you have a countable item over there.
yeah, the blade's already off of it, it's on your sharps, because not put back on when you're, when he said that.
Okay, you wanna secure this, cause everything's gonna fall.
Okay. Can I do that with that towel lamp?
Yeah, or you have another one, you can grab another one. You can only use non-ferrous, right?
Go through it?
So, you gotta go.
Oh, gotcha.
Okay. Alright, you wanna test your camera?
Striker,
That one doesn't plug in anymore.
I know, so I'm trying to get it somewhere where
What?
it doesn't fall there.
Okay,
No,
go ahead.
What am I doing?
So when you put this up, never point this at the surgeon.
That makes sense.
Yeah. Cause if that light was on, you would blind me.
Just blind all the med students over there.
That's fine.
And then this is where I
Pass the circulator to turn
turn on the
camera, or the light for you,
light.
right? And then you can try to white balance.
Do you hold it off of the camera?
Nope, you can just touch
right
it.
on it?
Yep. Cause it needs something white to white balance. Okay, white balance complete, cause you're not focused, so go ahead and turn this knob. So focusing, guys, is the gray knob. So you don't wanna turn the holder camera part, is the middle part, there's a knob that you can turn it. And sometimes it's on the bottom, it just depends on what kind of system you get. But for this system, it's you turning the knob.
Do you want us to focus first before we white balance?
Yes, yeah, you should focus, yeah. Unless I'm going in with a trocar, then you will focus inside the trocar. Okay.
So I've turned it.
Is it focused? Okay. There you go. Okay, so that's done. And then you can ask the circulator to light on standby now.
And you kind of just leave that right there.
Yeah, you can leave it. You want Fred up?
Do you bring both?
You will already pre-wet it here,
Okay.
so just verbally announce, I'm putting, solution on here. And then, a lot of times, some people, they like to put a towel clamp to clamp this too. I mean, for now, just don't take the whole sticky off, at least we're sticking it on here. Okay, alright, you wanna get started?
I do.
Yeah.
Time out, right?
Yep.
Patient is Larry David, procedures left chole, weight 70 kilograms, no known drug allergies. Surgical tech is Scott, the circulator is Destiny, and the surgeon is Sherry.
I'm Scott. I'm the surge tech today. My instruments are sterile for the indicator. My medications on the field are 0.9% sodium chloride and 1% lidocaine with epinephrine 1 to 100,000.
Okay. Sherry surgeon, we're doing lap chole, possible cholangiogram. Local?
Local.
Is that your control syringe or is that regular syringe?
I think it's regular.
Where's your control syringe? Local going control syringe. And also you have what? What's wrong with this picture?
I'm covering.
Nope, what's wrong with this picture?
It's not full. Oh, there's air.
There's air. Yeah. So take that sticker off, put it on the control syringe. Take off your hypo, put all the,
Put this.
put this
in
back,
here.
yep.
So could you use this now if you did that?
You can flush it out with saline, it's fine. How would you draw it?
Yeah, you could just draw it the other way.
Oh, gotcha. All these experts watching me now.
I was like,
You're judging.
you're not doing the, no, I'm just kidding. Like, what's going on? Okay, get the air out first before.
Of course.
Yeah. Did I show you guys this about getting the air out? So if there's air, there's bubbles. Put your finger on top of the hole right here and then plunge it, then all the air bubble will come out. Okay, habit. If you get into a lot of vascular, this is like a habit. I always do this to every syringe, just because to get the air bubble out. And then now you can put on the hypo and then flush that first part of the hypo so that there's, you know,
Just like
exactly. There you go.
sick.
Okay.
1% lidocaine with epinephrine, 1 to 100,000.
Injecting local.
Okay, and then cokers,
I'll take a 15. You can make the decision.
sharps.
Okay. Decision and rate type. So remember, you still gotta put 2 up.
Okay.
Alright, I will take, I'll do cut down, so I will take a cryo.
Straight or curved?
You only have 13.
Isn't this a cryo?
There's 2. Those are your tiny cokers.
Gotcha.
So just always have 2 up.
Okay. I was going off T's picture.
Okay. Alright, dissecting. Okay, I'll take the poker.
Oop.
Stitch.
What is the state stitch supposed to be? Like,
So it like pulls on the fascia so that it holds it up. So a lot of times when they do this approach, they would just go in straight in with the trocar.
And that's this one,
That's why
right?
they want to make sure it's lifted so that it's not, when the trocar goes in, doesn't poke on anything.
and is that the OPDS?
Oh, yep, O micro, yep, or the UR6, or yeah, that's the closest shape of the needle.
Would you need 2, 1 for each side, or?
You would just use one and you can use that suture twice.
Gotcha. You said it's an
O micro, yep. It's either UR6 what we have or UR5, I think. So when you load this needle, guys, you see it's pretty much almost a half circle, right? You want to make sure you load it in the middle, because if you don't, I will be turning and taking a really big bite, okay? So you got to put it in the middle, then I will go through and through, then I will come out, and then I'm going to have you snap.
Snap. Or
Cryo.
cut.
Snap, cryo, yep. Because we're going to use this twice, right? So, snap it here. Okay, and cut. Right here. So, you have to snap it. Ring finger. Ring
Can
finger.
you get both of them?
Ring finger. So, when you hold a hemostat, it should be always facing this way.
Okay.
Okay.
You clamp both of them?
Yep. And then you cut right here.
Is that good?
Yep. Does that make sense?
Yep.
So you have one side on now, okay? Now I gotta do the other side, alright? So I'm gonna reload my needle. And I'm gonna do this side.
And then
Did
you'll
you do
need
this to all 3 incisions?
No, just the
Just-
bigger trocar.
Okay.
Because anytime you'll use a Vicro is because you have a bigger port. And typically it's 11 and bigger. 5, you don't need to close the fascial layer. These 2, you wanna do it because you wanna prevent hernias in the future. Okay. Okay, so now you cut, so clamp here again. Clamp the hemostat. Okay, and cut by the needle.
So good?
Yep. And then needle back, protect it.
Then I put that down.
Yep, so now we have two, right? Now we can hold the fascia up, now that this can come out. And a lot of times they'll do more dissecting, for example, asking for meds, or I'll take, in this case, I'll take an S retractor,
Just one or both?
just one.
And like that?
Yep, and then so I would go in, and sometimes they'll like do this swivel thing, go all the way around, making sure they're through and through, and not like near bowel, okay? So now I'll take the 12 trocar.
This one.
Yep. Okay, so this would go in, so can you hold this up? Sometimes the surgeon, hold the suture.
Okay.
So it will do this, oh, oops, that came off. This is too big. Okay, and then I will take, hold on.
Do we pass that attached to the trocar?
No, separate.
And that's just the syringe, right?
Yes, just air, the 5 cc. Yeah,
This
so
one?
that should be filled with air. Alright, and then you can do it, so push it in and then press.
Just
Feed
this
the air in, just press. Okay, take it out, do it again. Normally, bigger trocars takes about 10, like 8. So now it's good, so take it out. There you go, now it's in, okay? So now we put the insufflation on, right? So circulator, can you get the insufflation on, please? Alright, the insufflation on. Yep, and then now we're gonna insufflate, okay?
Okay.
Now we're putting gas into there. Now we can take this out, can you get the camera ready, and we can look. And a lot of times you'll see surgeons doing this, they're trying to tap the belly and see if the air's going in, it's
And
not going
you
into the
tell?
interdam. You can tell or I can tell. If I'm doing this, I'm ready to go in and look, so
Okay,
you can help
so
me.
can you cut the lights?
I could do it.
And do I put this in?
No, you gotta turn on the lights first though, now we're dark, you gotta turn on the lights, there you go.
Gotcha.
Yep, and then now we would go in, and I would go in here and look for, so you can help me focus in. And we will take a look, oh, you got all the contents still in there. Is the gallbladder in there?
I don't think there's a gallbladder.
Okay, let's just pretend
Can
that's
someone-
gallbladder.
We can grab it
Oh,
real quick if
two?
you want to.
Yeah. I mean, it's okay, I'll just say this
I think
is
we use the
gallbladder.
hernia.
Okay, that's fine, I'll just say this is gallbladder, that's fine. Okay, so now we're in, now I gotta put the 2 additional sites, right? So, are you ready to hold this? I need local. So remember you
Poking
can't
the
move this.
barrel.
Exactly.
Now there.
Hold right there, just pretend that's the gallbladder. Okay,
1% lidocaine with epinephrine.
alright, injecting for local, needle down, nice,
So now you're making the 2 other holes.
correct. The other codes for the 2 trocars.
And this is the
I'll take 15.
15.
Yeah. Some surgeons, 8, 11. So, poke, poke, knife down, trocar. So 2 5s.
2 5.
And you use the 15 light.
Yes, 15 or 11, surgeon's course. Okay, so can you find me so I can put my trocars in? All the way up here. There we go. So, okay, alright, going in.
Do I follow it? Or just like.
Nope, you can follow, yeah, you can follow a little
Okay.
bit, but I'm sure we're not, because the belly will be like distended a lot, so you guys can't, you won't be able to see like that. It's just this is rigid, that's why. Okay. Alright, going in. Can you find me? Up. There we go. Okay, going in.
It's like an action man.
Alrighty. Okay. Alright, I'll take this grass first.
Graspers.
In the meantime, I'm just gonna switch it.
Procedures.
So when would you switch all this stuff?
Like as I'm putting on my last port.
Okay.
Yeah.
While I'm holding the camera?
Yep. Or you can tell me to hold the camera.
Okay.
You gotta communicate with your surgeon. So a lot of times it's just you and the surgeon.
That's scary.
Okay, I'll take the grass first.
Bear with me, Sherry. So should I put these on this side so I can see them, or am I looking
Yeah,
for?
that's good.
Tips to
Prestige.
you.
Tip should be towards you. Prestige.
This guy?
Yep. Yeah, the prestige, yeah. Prestige is not alligator. It's different. Alligator is more sharp.
So I need to
Okay.
find it, right?
so remember, this, okay, you guys, this camera, this power button always has to face the ceiling at all times. If you're turning, because it's a 30-degree, you can turn the light cord, and it flips the view,
Okay.
okay? So try flipping the view and see what you see. Just the light cord, right here. Hold on to this, you always wanna hold right here. This is not moving at all times.
Like that.
Exactly, now you see a different view. Okay, that's only if you have 30. If you have 0, you're looking right at it. So if you're thinking about, like, let's say gallbladder is like right here, you're trying to aim diagonal. So your object should be always diagonal to your whatever camera's looking at. So like,
Oh.
does that make sense? So you turn, go ahead and turn. So a lot of times the surgeon would say, turn to 12 o'clock, turn to 3 o'clock, turn to,
And you're
6
turning
o'clock.
this.
You're turning the light cord because that changes the lens and it flips it to see different, more view, I would
Okay.
say, okay? All right, so now we're in, so follow me. Okay, so let's say that's we're peeling down, I found the gallbladder. Okay, let's just say this is the gallbladder. Okay, I found it, so I'm gonna lift it up, right? So
Okay.
that I can lift up the liver part too.
Mhm.
Okay, so now I wanna do some dissection. Normally there's always a fat pad right outside of the cystic duct and artery because it protects it. So I'll take the hook cautery so I can do some dissection.
The hooks.
The hook cautery. Okay, so hold on. So don't move that, and then you should say what?
Can you hold the camera?
Yes, I can hold the camera.
Where?
Right where,
This?
it doesn't have clamps on it.
tiny hook one right there, yes.
Oh, gotcha.
Okay, so go ahead and put the hook on with the cautery. So, right? The gray cord. There you go. Thank you, circulator. Okay,
Does that just push on like that?
Yep.
Okay.
it's normally like that. It's not the same. It's not meant for this, but yes, it goes on like that. Okay, so, yeah, okay. So I'm just gonna go in here. You watch me. Where am I? So, okay, so let's just say I found this is a fat pad, so I'm gonna dissect, okay? So now I got the fat pad off, because a lot of times the fat pad it will bleed.
Okay.
And I'll take the Maryland, so I can dissect the two structures, which are,
The cystic duct and the cystic artery.
okay, I'll take the Maryland,
And that was this one.
okay? So,
You pulled out your trocar.
yeah, my
I was gonna
trocar
say
came
that.
out. Good call. So what happens now? Okay, where'd they go?
Re-enter with the
And then you have
operator.
to put the operator back in?
Yep, so go ahead.
Would I have to clean this again before? Okay.
Okay. Look for this side again. You don't have to turn your camera, but I'm on top. I'm gonna come in. Okay. All right. Okay, and I will take Maryland. We're gonna do some going down here, dissecting. Okay, I'm ready for clips. You would clips.
Can I get that? It's the ligature, right?
Nope.
No?
Clips.
Clips.
Ligature is a burning device, right? The bipolar device.
And it's the clip applier.
Yeah, let's go with plier.
Can I see the? I don't think they do.
Yeah. Or Maryland is this.
It looks like
This
it's
is
for
Maryland.
Okay.
Alright.
When you still have
Let's just say we're gonna. Okay, let's just say we're clipping. And we're gonna do 2 clips. So clip. So 6 clips total, 3 on each structure. And then now we're gonna amputate.
Okay.
We're gonna need some kind of,
Scissors.
yep, so I'll take the nets. Okay. We will go in and we will cut and cut. Alright.
And now you need the back, the
Back.
endo.
Yep.
Endo catch.
Yep, and a patch.
Or do I ask you to hold this
Yep,
or
I
just
can
grab
hold
it?
that.
Okay.
Yep. And then I will deploy the bag, put it in the bag. Okay? And then this is where I need a pee at.
Okay.
Or a pee on it, whatever you got.
Like a.
Yep. Doesn't matter, anything. Cryo is fine too. I just need to hold on to the bag,
Yeah.
right? Because the bag is still here. Okay, alright, so let's irrigate and then we can get out of here.
Okay, so take camera out?
Nope,
No?
irrigate.
So you do irrigate with
To
the specimen in there?
to
Okay.
Yep, the specimen's still in there.
Oh.
Can you
Yeah.
hold this?
Yep, I can hold this. Normally the doc will try to minimize putting the trocar in and out, so they will just do it all at once. And then the specimen comes out and then check the trocar size and be done. Alright.
Good job, Alex.
Thank you.
I don't see the,
And he has the tip over here.
And circulator would run that?
Oh,
Yep.
yeah.
You can just-
Yeah.
They- yeah.
It should go on the IV pole. Alright,
This one doesn't fit?
it should click on.
Oh,
There you
gotcha.
go.
Okay.
Alright,
There's a loop right there.
okay.
And I would
And then, yep, you'll give this to me.
Okay, we'll just wire run that.
However, what's wrong with this cord?
We need to secure it.
Clamps.
Yep.
Do I have to do this on this side?
Nope,
No.
you gotta secure it. There you go, perfect. Okay.
Oh, what is that thing?
Okay, and we're back to you.
That's
I'm
the
gonna
good
go
one, right?
I'm gonna irrigate. Okay, it looks good. Okay, can we have, I'll have you look at this site real here, real quick before I pull this out. So can you look at this, the big profile? So this way.
Oh, gotcha.
Yeah, I just wanna see, make sure it's not bleeding inside, and then I'll take out the syringe or a hemostat or anything.
Syringe.
And then circulator, I dropped the thing, that's fine too. Okay, this is out. Alright, so, room light back on, camera off, we're done. Through? Yep, on standby. Alright. Oh, so you did need this?
Yeah,
Okay.
Brianna.
I'll take my clothes.
That's
and
only
stuff.
if they want it.
Okay.
Otherwise,
Oh,
we'll
so
just do
the
like a
color
fashion
Would you have
stitch.
pulled that?
So I can, we're gonna pull it out, so normally this will come out, which I'm gonna make you guys a bag so you can pull it out.
Okay.
And this will be a specimen.
Sweet.
Thank you.
It's a specimen.
Specimen.
Would you like it cold?
Gallbladder,
How would you like it done?
permanent at the end. And we're just gonna, I'm just gonna use my stay stitch to close this, so it's done. I'll take the scissors.
Those are under my pile of goodness.
So start putting your laparoscopic stuff away.
Okay.
Your scissors are right there. Yeah, and it's gonna look like this. So
Oh, good.
you guys can work on organizing this. Okay, scissors. I'm gonna cut. Okay, I'll take my monochrome.
Sharp. And you want
Monochrome. Skin. You're right.
teeth.
Oh, skin.
I had it.
Yep. Okay, alright, you can do your thing.
pop this since it's brand new.
Yep, you can do your thing.
Would I ask you what type of dressings you want? Here?
Yeah, that's it,
Okay.
yep. Skin glue.
Skin glue. Can I get skin glue? Removing.
You wanna wet and dry before you do that, you gotta do what? Yeah, you gotta count.
1, 2, 3, 4.
Count before I hand you dressings.
Oh, yeah.
Okay.
It's just like other procedures.
Yeah.
It's all the same steps, you gotta count.
Wax.
Typically, fascial layer, when I'm closing my vicryl, just tying it off, you should be doing your first count.
Okay.
Wax,
Sweet. 0.
spray text.
You done with this?
Nope.
No. 1 on the field, 2 up.
What?
Pause count.
Do your thing.
That's good.
Yep.